Hi, it's Kristen with Mimi's Blessed Journey. I just wanted to go over some pre-authorization stuff that you need for weight loss surgery. If you are just thinking about weight loss surgery, there are so many hoops that you have to go through, it's not even funny. So here's just a basic rundown of what, now every insurance is different and every surgery company or surgery center is different. So depending on who you go to and who you have your insurance through, this is all could be completely different, but most of them are generally right around the same things. So when you start thinking about weight loss surgery, the first thing you need to do is call your insurance company and see if they cover medical weight loss, which would be bariatric surgery. And then if they do, they'll tell you what you need to qualify. It's kind of like you have to be sick enough to qualify, but healthy enough for surgery. So there's kind of a fine line there. Generally, the standard is you have to have a BMI of 40 or above, which is a body mass index of 40 or above. You can go online and find out what your BMI is generally. And then if it's lower than 40, it can be 35 or above. If you have two comorbidities, generally those would be a disease or a sickness that you have that's basically weight related, like high cholesterol, diabetes, high blood pressure, something like that. So if you have two of those type things, then your BMI can be 35 or above. Then once you are a candidate for it, they'll tell you how much they cover and what you're going to need to cover yourself. You would need to go and talk to your primary care physician. He'll need to put you on a medically supervised diet, and that can be different for every doctor. A lot of times they'll put you on a weight loss pill called Ventermine and see how that does for you. It's Weight Watchers and all those Adkinson and all those kinds of things do not qualify as a medically supervised diet. So you'll need to see your doctor every month for about 3 to 6 months depending on your insurance, and you're going to need to log your food intake and your exercise, everything you put in your mouth and every exercise that you do. Your doctor may put you on a calorie restriction. He may tell you about carbs and sugar, and so whatever medically supervised diet he decides to try. And if he tries one for 1 month and it doesn't work, he can change it up to something else. So for between 3 and 6 months, they want a medically supervised diet, and you'll generally need to be keeping a food log of everything that you're eating during that time. And then he sends his reports to your insurance company, and they are going to either approve you or deny you based on it's kind of a catch-22. They want you to be on a medically supervised diet, but it almost can't work. So, I mean, it's great if you lose a little bit of weight, but if you lose too much weight, they will deny you for surgery because obviously you don't need surgery, you could just do this diet. So that's kind of how that works. So once they approve you for surgery, they're going to start, I forgot a major thing. They'll tell you, your insurance company is going to tell you what doctor you can go to that's covered under their plan. And in Las Vegas, there was only one doctor here that I could go to. So you call the surgery team and you get scheduled for a seminar. They almost all have seminars. They're just a couple hours long. They're free. And they tell you about the way that they do the surgeries. They tell you what surgeries they do. And they describe each surgery and which one is maybe which one is best for you. They talk about there was like 80 to 100 people in my surgery and in my seminar, and they do about 3 to 4 times a month, different days, different times to try to catch everybody. So you just have to go to one seminar, and it's free, and it's actually really good. I would bring your loved one to that seminar because that's kind of a general overview of what life is like after surgery, what they do during surgery, some of the pre-authorizations that you have to get into surgery. So it's just really informative. So if you're going to bring somebody to an appointment, I would think that would be the one. And then that's kind of the one that you decide. That's in the very beginning. That's before you even go to your doctor and start your pre-op diet generally. Although I guess you could do it anytime. It's just required. But I would say do it right around the time you go to your doctor for your pre-op visit, because it'll give you information on what constitutes medical supervised diet and all that kind of stuff. So you don't want to be doing something wrong for 3 months and then go to your center and find out that they don't accept that. So you'll need to turn in your food log to your surgery center, most likely, and your pre-authorization letter from your insurance company, and then you can start doing your medical testing, and that would be an EKG. They want to make sure that your heart is okay to do surgery. It'll be a chest x-ray to make sure your lungs are clear, and a lot of different blood work, and you can do those through your primary care physician. And then once those come in, you can do your psych testing, which is a psychologist. For me, it was really run-of-the-mill. Like, it just felt like something they had to just check off. I mean, you fill out this long questionnaire, and then they talk about, are you eating for comfort? Are you eating for emotional reasons? Are you eating, are you binging? And when was the last time like, they just ask all kinds of questions, and just want to make sure that you don't think that this is going to be like a cure-all kind of surgery. Like, you really need to do your research. And obviously, if you're on YouTube watching these kind of videos, you're probably doing your research. So the psych test was really, really easy. They will fax the authorization or the approval for your psych test to the surgeon's office. And then once all that is turned in, you'll need a letter from your doctor stating that you are medically cleared for surgery, and you'll need the last doctor's appointment notes, and that will all need to be sent over to your surgery center. And then once that's all done, those are all your pre-authorization things. Generally, that's when they can schedule you for a surgery consultation. So that's when you meet with a surgeon, and you talk about what surgery you're going for. There's the gastric bypass, the lapband, or the sleeve, and you just talk about your expectations of the surgery. You talk about, they weigh you, they do all that kind of stuff. Make sure that you have a clear picture of what it is, and he'll go over your medical things and everything. And then once you have that appointment, the surgery center will schedule you for a surgery date. So there you have it. And during that whole process, depending on how your insurance is, you'll have co-payments for the blood work and for the EKG and for, all that. The x-ray, you're going to have to go to someplace different to do the x-ray, and the psych testing, you'll have to do a co-payment. So it just depends on, everybody's insurance is different, how they bill it. You'll have to pay whatever deductible you have for your health insurance, and then they should cover most of the rest of the surgery. A lot of places do 70-30 or something like that. So it just depends on how your insurance is. But be prepared to have co-payments, for specialists and stuff like that, and to probably have to pay your deductible for the surgery. But I will tell you, a friend of mine was looking into surgery last year, and she was not quite overweight enough, and she was too healthy. She didn't have any comorbidities. She didn't have high blood pressure, high cholesterol, all that stuff. And so she was looking into her health insurance wouldn't cover it. She was looking into paying for it on her own, and it was going to be about $17,000. So it's worth jumping through all the hoops, and they're really just doing it to make sure that you're safe and that you really are a good candidate for the surgery. So I know it's really frustrating, but they have to do their jobs. So anyways, if you're thinking about what medical weight loss, lap band, gastric bypass, or the sleeve, they're 3 completely different operations. They do a lot of the same thing, and you just need to do all your research, and those are the hoops that you have to go through generally to be qualified for the surgery. So just wanted to go and give it to you in a nutshell. Thanks.